present bilaterally.
Okay, and both terms are correct in making a clinical diagnosis of a benign tumor. Now, as to the specific type, considering the bilaterality of the lesions and considering the age, what would be a most likely diagnosis would be a bilateral macrocyst rather than a bilateral fibroadenomas are usually seen in younger patients. Do you agree, Sok?
Well, this actually, you can consider also macrocyst in this matter, because this macrocyst represents any size with a well-delineated border, with the key findings of a dark hard mass and with the slight tender.
Okay, what will be the next step that you're going to do after your clinical diagnosis in there?
After we have established our clinical diagnosis, I think we have to ask ourselves whether we are so certain or how certain we are with our clinical diagnosis. And after that, we decide to see that we established the clinical diagnosis. The next thing we need to know is that is there a need for a clinical procedure to make our clinical diagnosis more certain if it is not certain initially.
So are you certain of your fibrocystic diagnosis?
No, doctor.
So what will you do next?
Since I'm not so certain with my clinical diagnosis, I would then plan to do a paraclinical diagnostic procedure, which is needle aspiration biopsy.
Okay, suppose you aspirate the left breast mass and it yielded 2 cc of yellowish fluid. What's your diagnosis now?
With findings and needle evaluation, then my first consideration would be macrocyst.
How about on the left, which you have not aspirated? What would be your diagnosis on the left breast now, after you have done aspiration on the right?
Still, I would consider continue to do a needle aspiration on the same amount on the other side of the breast.
But what will be your present diagnosis? Still fibrocystic or macrocystic?
Macrocyst, doctor.
And you would proceed to doing another needle aspiration on the left breast, right?
Yes, doctor, because doing a needle evaluation with aspiration is both diagnostic and also therapeutic in this particular case.
Now, then suppose an aspiration, you get, this time you get 2.5 cc of greenish fluid with complete disappearance of the mass. What's your diagnosis now?
Still, I would consider macrocyst.
Okay. Any question from the side? Any comment?
So I would agree with the diagnosis.
Okay, remember that particular case, this is just to bring out a very common situation that we see in practice. Usually 40 or 50 years old, 60 years old, patient presenting with bilateral breast masses, clinically benign. You always consider the possibility of macrocyst rather than the fibroadenomas. And remember that fibrocystic changes, as we agreed, they don't present with macro nodules or macro masses. Now next, Now suppose, okay, we change now the age. Instead of 50, we change it to 25. 25-year-old female married, right and left breast masses 2 cm in size, not hard, slightly tender, no erythema, movable, well-defined border, no axillary node. Same case as the previous one except the change in age. Dr. Boa, what's your diagnosis now?
Based on the physical findings and also the age of the patient, I would consider here galactosile.
Any disagreement from Tondo side? Richard? Galactosile for that particular situation? Any disagreement? Next?
If the patient had a history of breastfeeding, then we could consider galactosile. But since we were not given that information, I would rather opt for probably a benign condition such as fibroadenoma.
Would you like to react to that, Dr. Boa?
Doctor, can the other scientific statement?
Let's hear it.
I said that since we were not given the information that the patient is having breastfeeding, so I would not consider first galactosile, but instead I would first consider fibroadenoma.
Okay, are you ready to react, Dr. Boa?
Yes, I agree with you.
What made you think of galactosile, Pabs?
Even though the patient did not present any history of depression adaptation, the patient is of reproductive age and she is married, and the patient presented with a bilateral mass. This data led me to conclude that the patient might have galactosile.
Between galactosile and fibroad, which one is more likely? The absence of the data that shows positive for lactation.
Doctor, in the absence of the data that the patient had, in absence of the history of recent lactation, I will still consider fibroadenoma.
Okay, Richard, would you like to react?
Yes, sir. As we have known before that fibroadenoma is more common unilaterally than bilaterally.
Do you agree with that, Dr. Chong? Fibroadenoma is more common unilaterally than bilateral.
Yes, sir.
And that's the reason why I think go for a fibroadenoma diagnosis.
Yes, sir. Over the finding.
Do you agree with that, Jan?
Considering that the patient is a 25-year-old and is a well-defined border at 2 cm, non-hard, I still consider fibroadenoma, whether it's bilateral or unilateral, still fibroadenoma.
Okay, let me try to synthesize the discussion at this point in time. Earlier, I presented a patient who is 50 years old with 2 masses, right and left, with no signs of malignancy. And we said that we have to consider galactosile because of the bilaterality of the masses and also of the multiplicity of the masses and also the age. Now, in the younger patient, 25 years old female, which we presented, this patient also presented with 2 masses, or multiple masses. Again, with no signs of malignancy. So the foremost consideration should be fibroadenoma. Now, although unilateral fibroadenomas are more common than bilateral,